Hi guys, welcome back to my channel. This is a bit of a different type of video since I'm sitting down and I'm literally on the floor of my bedroom, and I'm here to talk about my experience with my nose surgery. So if you couldn't tell already, I had a rhinoplasty. I feel like you can't really tell unless I give you like a before and after, but we'll get to that in a second. I will also be putting my friends and cousins' reactions to my face in this video. But first of all, yeah, I got a nose job. I went to Vietnam to do it actually because I was there in May, the end of May, which a whole bunch of videos will go up after this one, but I just wanted to put this one out there first because in those vlogs I mentioned this but with no context. So I thought I'd do a sit down because there are a lot of questions that people ask me, so I was like, why not do a video? Anyways, I have literally a whole like list of notes and everything from day to day, any of the questions that I had that I asked my surgeon about and things like that. A lot of people are scared to get a nose surgery or just surgery in general, which is totally understandable, but I will put everything that I experienced in this video. First of all, I want to preface by saying that everything that I mentioned in this video is my experience and my experience alone. It's not medical advice. I would say follow your doctor, follow your surgeon, do what you want, but everything is from my experience and my experience alone. So now that that's out of the way, for an introduction, I got mine done at JW Korean Hospital, which is in Vietnam. So it's a franchise of a bunch of plastic surgery hospitals or like cosmetic hospitals in Korea that has opened up in Vietnam. I found this place because my grandmother has actually been with her friends to get some surgeries done before. A few of them have had their nose done there too, and like a few other surgeries. So I knew that this place was like vetted because she's been here before. Like obviously when I think of Vietnam healthcare, I don't know, just me, because it's like a third world country, you wouldn't expect like the greatest healthcare system, let's say compared to Australia, where, I mean, Australian healthcare system is literally not that great either, but it like you'd think it's better than a third world country. But like as soon as I went into the hospital, like the first day I was there, I was like completely put at ease. Like I wasn't scared or anything. It was like legit, obviously, but like I was talking to my friends in Vietnam and they were talking about how healthcare is good in Vietnam. Obviously, if you have money to pay for it, then you'll get the best facility. Like JW is probably one of the bigger ones. Oh, Louis is flying on the camera. Yeah, so JW is one of the better and bigger hospitals there for plastic surgery. So it is quite expensive compared to like another hospital that you get in Vietnam, but it's a lot of a you get what you pay for kind of thing. So the service was really great, but I'll get to that in a second. What did I ask my surgeon for in the consultation? So what happened was I landed on May 27th and I had already got my doctor's appointment for the surgeon booked by my family friends that live in Vietnam. So basically before I got there, everything was already booked. But if you don't have that luxury of someone calling on behalf of you, you can contact them through WhatsApp, because I feel like everything in Asia is always like WhatsApp, Zello, or like something else, or Viber. They also do Viber. So you can contact them through that. You can text them and call them in English, like they're completely foreigner friendly, like they can accommodate if you don't speak Vietnamese. So then on the 28th, so literally the next day, I knew when I landed in Vietnam on the 27th that I couldn't eat past midnight. So that's what the surgeon told me. If I'm having surgery the next day, I can't eat past midnight. So I landed, I ate, and then I had my doctor's appointment at 10 a.m. the next day, so the 28th. By that point, we had a consultation and I basically spoke to the surgeon about what I wanted out of my nose, like what kind of look I was going for and what I didn't like about my natural nose. And I want a bit of a bridge, but I don't want it too sharp on the tip. Like I don't want it to be pointing, or like if you look at me like this, I don't want the nostril to be up.
Okay.
Yeah.
Now look natural and longer a little bit.
Yeah, but a little, and like a little bit slimmer.
Oh really? No.
No?
No.
You don't think so?
When you surgery, this one will
go in already.
Yeah.
Oh, okay.
Yeah.
I have 3 incision sites. So there is here underneath, so right here, my rib and my ear. I have my rib cartilage, which is in my bridge. I'll do like a proper video of my nose, and then I've got ear cartilage, which is the back of my ear here, in the tip of my nose. So during my consultation, the surgeon said that initially we thought that I was just gonna do ear cartilage, so then it would be a much quicker recovery time. But upon touching my nose and him like feeling my face, my natural nose is too soft to put just ear cartilage, because ear cartilage is not strong enough to hold up my nose because there's nothing else substantial around it. My natural nose just didn't have enough cartilage and not enough structure. So that's when my rib cartilage came in, and that needed to be in because it's much stronger and it would hold up my nose. At that point, I hadn't actually scheduled my surgery because that was just a consultation. So I didn't eat just in case that I could have gone in straight away, but I got lucky because at that consultation, he did have a slot for 3 p.m. that day. So it was 10 a.m. consultation appointment, and then I just had to wait another 5 hours. Honestly, like, it didn't bother me the fact that I didn't eat. Like, I was hungry, like, don't get me wrong, but I just wanted to really get it done that day. Like, I was happy to wait the extra few hours of not eating to get the surgery over and done with, because I didn't want to extend it and then ruin the rest of the holiday in case I had a bad recovery, because I didn't know what my recovery was going to be like, and I've never had surgery before, so I didn't know how I was going to react to like anesthesia and stuff like that. Also, my grandmother, she had requested for a specific surgeon, which is the head surgeon of the hospital. If you look up their hospital, his face is all over the socials, because I'm pretty sure he runs it. Yeah, he runs that hospital. Like, there was a certain extra price because we requested him rather than just getting allocated any doctor or any surgeon. I'll get to price in a second, but yeah, we got the appointment, surgery time at 3 p.m. So around after that consultation, 10 a.m., I got a bunch of labs done, basically. I had a blood test, I had a urine test, I had an x-ray, chest x-ray, I had an ECG. Like, I had a full body checkup because they wanted to make sure that I was eligible to get a surgery before, like, basically exactly confirming that 3 p.m. would be possible. But yeah, so they tested everything to see if I was completely healthy, and I was. So they were like, please, you can go in. But I actually have a funny story. I have thalassemia, so that means that I have really low red cell count and hematocrit, basically meaning that I have very low, like, cell turnover and oxygen levels in my body, so I get winded really quickly, and I get, like, if you're walking with me, you'll probably hear me breathing loudly because I just get puffed out. So, and it's also the type of anemia where it doesn't matter how much iron I consume, it just doesn't stay in me. So I'm like constantly up and down on supplements. Anyway, besides the point, I was getting my blood test done, and I said to the nurse, I have thalassemia, so I tend to black out when I get a blood test. Sometimes I don't, and sometimes I do, but I always just say it just in case that I do, so they're prepared. So I was sitting up to do my blood test, he was real, and I had my arm on the table, and I was like, okay, so we're gonna do this sitting up. Putting it in, he puts the first one in, and I was like, oh, okay. Well, sorry, let's not say the first one. He put the needle in, and he's like, wow, it's really slow. I was like, yeah, probably because I haven't, like, drank that much water, and I'm starving and whatever. And I have anemia, so it's hard to get it out anyway, just on a regular day. So he just puts it, and then I start to get woozy. I was like, I close my eyes and I'm leaning against the wall, and I'm like, I think I'm gonna pass out. But I hadn't passed out at that point. And he's like, oh, I have to do it again and find a different vein. Takes it out, barely gets anything. So then and then I'm like back to life again. He puts another one in, instantly blacks out. and then I wake up to 4 nurses holding me against the wall so that I don't fall forward. I can understand Vietnamese, so obviously they panicked, but, well, like, not panicked in the sense that they know, like, it's serious, like I'm dying or something, but whatever, like, I blacked out. They're holding me against the wall, and I can understand Vietnamese, and one of the nurses says to the other nurse, look at her eyes. So then they get light to, like, check my pupils, and my pupils are not reactive. So I'm still very much just waking up from blacking out. And then they eventually get me to lie down, and then right after lying down, this is typical, very typical, right after lying down, I'm back to life again. Like instantly I'm back to life. So I was just laughing about it, and my nurses kept checking on me like every 2 minutes. They're like, are you okay? Are you okay? I'm like, yeah, it's fine, this is normal. I'm just laughing like, yeah, whatever. Are you okay, Louis? Then after this checkup was all done, I got to my room. I was with my grandmother at this stage. She was staying with me. And I wasn't prepared for them to tell me that I had to stay overnight, so I didn't bring anything. Yeah, at 1 p.m. I had a full antiseptic shower, so they gave me antiseptic soap and I had to full scrub everything. And then they told me that the surgery before me got delayed, so then I had to wait till 5 p.m. which was okay. Like I wanted to get it done at that point, so I was like, it didn't bother me. Then came the time for me to go to surgery. So at this point I was by myself. My grandmother had gone back to our family friend's house who we were staying at the time. We weren't at a hotel yet. I went to go get my stuff and her stuff because she was gonna stay the night with me. At this point I wasn't scared. I don't know, I was just like, let's just do it. Like I'm very much the mindset of just do it and don't think, just go. Otherwise, like if I hesitate then I won't do it. Like obviously I wanted to do this, so I was like, just go. Like I had a game plan. I wasn't scared, whatever. So my nurse walks me to the anesthesia room, which is right next to the surgery room, not the theater. Then she lies me down and she's giving me high flow oxygen. She puts a heart monitor on my toe and she's like looking at me, and then she starts smiling because you can hear my heart rate from the heart monitor going off like the speaker, like right below next to me or below my feet, whatever. And it was going fast, like I was shitting it. And it was like beep, 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 beep. Like it sounded like someone was having some serious heart problems, but it was just me like having a panic attack. And I was sitting there by myself on the bed. And then then there came another nurse and she started laughing. She's like, is it your first time? I was like, yeah. She's like, don't be scared. The nurse's surgery is so small. And I was like, okay. She's like, just talk to me. And then, okay, I was like, couldn't talk because I was like nervous at this point. And then she's like, okay, I'm gonna put your catheter in, your needle, and this is where your anesthesia will go in. And I was like, okay. That was the part I was most scared of, was that, because my mum always tells me that when she gets anything done at the hospital and they put that in, it's so painful. My mum scared me so much, that's what I was scared of, not even the actual surgery itself. It didn't even hurt. Like I felt nothing. I feel more in a blood test than the freaking catheter. Anyway, yeah, they put it in and then she's like, okay, I'm gonna start administering the anesthesia soon. And I was like, okay, sure. Then there's a door next to me and I can't see through the door because there's no glass, like there's nothing, it's like a solid door. The doctor opens it and it's the surgery room right there, and someone is obviously in there having surgery. And that's when I actually started like shitting myself, because I thought to myself, I'm like, that is gonna be me next, and there is someone on the table and I'm freaking out right now. So then I started freaking out even more. But then I didn't really get a chance to freak out that long, because then she started administering the anesthesia. She's like, okay, I'm gonna start putting it in now. And then like, I said to myself, like, don't fight the anesthesia because it will just make it worse. Like just, the faster I go to sleep, the less stressed I'm gonna be. So as soon as she put it in, I just like closed my eyes and I just went. Basically like the best sleep I've ever had in my life. And if you know me, I'm a terrible sleeper. I'm the most sensitive person when it comes to sleeping, and I just can't sleep. All I do remember is me waking up in ICU and I was absolutely freezing, like freezing. My body was shaking. I had heater on me. I had like 5 blankets and I was just shaking. Apparently I was in there for 3 hours because my brother and my family friends actually came to my room to sit and wait for me to come out of surgery, because they knew what time I would finish surgery. I'd finish surgery around 7:30. Yeah, so because the surgery was around 2.5 hours to 3 hours. So they were waiting there, and like, how come she's not coming out? And then they asked the nurses and said, because I was in ICU for 3 hours, because they're monitoring me, like slowly waking me up, whatever. I don't exactly know how long the time passed when I was awake in the ICU, because I was so out of it. I was really tired. Then the nurses were like, okay, we're gonna take you to your room now. Can you get up and get in the wheelchair? Luckily, I was fine. I could walk, I was literally fine. Then I went to my room. I was dead asleep for like 2 hours probably after I got to my room, and my grandma was sleeping in the room with me. She was so scared for me. She said that she was so stressed, she couldn't sleep, and there was me, like I was literally taking the best nap of my life. I didn't have any pain, I didn't feel anything. And then I just remember being really thirsty. You can't drink water for a certain time period after you just come off anesthesia. I was like, I desperately need to pee because I had drank so much water. So then I think it was like 2 a.m.-ish, and I was completely fine. I had no pain. I woke up. All I could feel was like it was really tight around here, and I think it was because of my cast, like, and all the pressure from the taping. And then there's a clip actually of my grandmother wheeling me in a wheelchair to the bathroom because the nurse was gonna do it and she wanted to do it. So she made him film her wheeling me on a wheelchair, which is pretty funny. Like I was kind of back to normal at this stage. I wasn't completely like myself, but I wasn't like tired. So, and if you see in the clip, she literally knocks me into every single wall and every single thing that's in the way, that I was trying to laugh, but my face was so stiff I couldn't laugh. For the rest of that night, I had to breathe through my mouth because I had my nose splints inside each nostril. So there's a hole, but I couldn't breathe because not just like all the cast, the compression, the splints, but also the fact that my nostrils inside, like my sinuses, were so swollen that I could not breathe. I still have this issue now, which I will talk about later, a swollen nostril, both sides, and like the back sinusy area is all swollen. But anyway, so then I get discharged at around 1 p.m. the next day. Yeah, I get home 1 p.m. and I feel absolutely fine. So I knew that, okay, if I have another incision at my rib, I thought I'd be in a lot of pain. But the next day, I didn't feel anything. I got home and I was like sitting in bed with my family friend and my brother and my grandmother and my auntie. And they were like, are you in pain? Are you tired? Do you want to have a sleep? I laid down for 10 minutes and I was like, I'm so bored. I was like, and we're in Vietnam. I'm not sitting in this bed. So then I literally got up and I said, let's go shopping. So then we went shopping. Yeah, and then I think we hit like 4 stores that day, but that's including the new playground, which has heaps of shops. Also, I'll be having a shopping video coming out very soon with a try-on haul with all my stuff. Yeah, I went shopping, and all that I was worried about was just bumping my nose. I'm not allowed to bump my nose, and especially with the cast on, everything was very bulky. It's quite uncomfortable, especially when you're in Vietnam, which is 35 degrees constantly and very humid. I had my cast on, which I was sweating and I can't wash my face. So yeah, that's another thing itself. So that is technically day 1 post-op. So the real journey begins on day 2. So day 2, I woke up completely swollen. My face was like a pillow and I slowly was losing vision because I was so swollen. At this point, I was like, oh, I haven't experienced swelling that badly and no bruising. So I thought as soon as I woke up on day 2 post-op, I was like, shit, I'm gonna get all of the swelling and all of the bruising that I'm supposed to get, like other people do. And this is the day it's gonna start, because when I had woken up from my surgery, I hadn't gotten it yet. So I was like, okay, I thought I was lucky, but I guess I'm not that lucky and it's just gonna happen. It's a natural course, whatever. Throughout the day, I went shopping again, and this day we shopped hard and I walked probably about 15,000 steps that day. I think another factor of that as well really helped is that the amount of steps I got in during the first 5 days of surgery. So my recovery wasn't really me sitting at home. I didn't lay down much until like when I went to sleep at night. So during the day, I felt like the more active I was, the quicker the swelling was going down, which was true. Because by the end of that shopping day, my swelling had gone down so much, and I could tell because obviously I had vision again, like I could see and my eyes were not like closed and swollen. I had to get a drip into like an IV drip for the first 5 post-op days for antibiotics and all that jazz because of my rib. So if I had just gotten an ear cartilage taken out only, the recovery time is much quicker and there's a lot less medication and IVs and antibiotics involved because it's not as extreme, let's just say. So my medication, absolutely crazy. At night I would have to take 5 pills from memory, and in the morning I'd take 1 before going to the hospital to go get my 3 drips. Every single one of these medications that I was on had crazy side effects. So I was on holiday with Jerry. So Jerry was in Vietnam with us. And for context, Jerry is a very, very smart scientist. She might not say this, but I will. I always say this. She was looking at my medication with me when I was taking it. And she was like, you are on some crazy drugs right now. She's like, they don't even give this out in Australia. And I was like, oh, okay. So I was on metronidazole, which is one of the medications I was on, which is an antibiotic. The side effects for these drugs was nausea, headache, migraines, diarrhea. And I thought to myself, okay, what side effect am I gonna get? Because I'm getting a dose of it at night and then through a drip in the morning. I got diarrhea. This is so TMI. I had diarrhea, which I think is the worst side effect if you're traveling in a country where you don't know where the bathrooms are. Like if I'm at home in Sydney and if I'm in the city, I obviously know where the bathrooms are. They're in Westfields, they're in like whatever, in the gallery or whatever. Like I know where to go for these bathrooms. I'm in Vietnam, in a country I don't know that well, and if you have diarrhea, that is the worst, especially in a third world country. I wanted to eat everything I like when I got there, and I literally had a food bucket list that I wanted to tick off being there, and I had diarrhea. So luckily I had prepared, and I actually bought diarrhea pills, expecting to get diarrhea from the food, not from the medication. And Jerry also brought some medication, so I had been taking supplements and probiotics to kind of mitigate these symptoms. I knew that this wasn't gonna go away until I had finished my medication and my drip. So that was post-op days 2 to day 5, because I was already at the hospital post-op day 1, so I already had gotten it, so I was going back and forth 2 to 5 days. So in my notes, I've got breathing during the sleep was terrible, literally. I could not breathe. Like the splint, like I explained, was in, but not just that, it was swollen, and then I am not a mouth breather. I do not sleep with my mouth open normally, so adjusting to being a mouth breather while you're sleeping is so hard. Like no one talks about this. I had the driest mouth when I woke up in the morning and the driest throat that I actually experienced twice, which I will never wish this upon my worst enemy, because I woke up and I thought I was dying. My throat in the middle of the night, because it was so dry, it felt like it had constricted and stuck together, that I woke up choking because my throat was so dry. That's how bad it was. And I was suffering the most from just sleeping. I was not in pain. Like I had no other like bad symptoms besides the diarrhea. Like that was manageable, it was okay. But the sleep, it was terrible. I was so out of it in the mornings because I was tired. I also, when I could sleep and when I had fallen asleep, I was sharing a room with my brother and my grandma. I sounded like a train. Like, I actually have a clip because my brother woke up in the middle of the night because he was sleeping in the bed next to me and he filmed me sleeping. So I'll insert that now. Okay, moving on. So this is post-op day 5. This was my last day of getting my drips, and I hadn't finished my medication yet. I think it was day 6 I had finished my medication, but day 5 post-op was removing bandages. So this is when I actually get to see my nose. I had no severe bruising or swelling besides day 2 post-op. I did have a bit of yellow from probably just some very, very small bruising that had been happening under my bandage, which I hadn't seen, but it had gone yellow because obviously I had recovered from the bruise before taking off the bandage. So I got quite lucky because everyone else on my floor that was also recovering from surgery, they had gotten a nose job too, had completely gone purple in this whole entire midsection of their face. And apparently they were telling me that their pain and their swelling was so bad that they had to get a second bag of pain medication, which I only got in 1. Jerry and I were kind of trying to theorize why I had not experienced the swelling, and I looked on TikTok as well some girls were saying that if you had certain supplements leading up to the surgery, like you won't get swelling and bruising that badly. I didn't do any of these preparation at all. So I just, like, my normal day-to-day diet includes like a probiotic supplement every second day or so with a vitamin C. So we were saying maybe that's what saved me from all this swelling and bruising. So there was quite a lot of swelling still, completely all on the bridge. So my face here, my cheeks were very, very, very stiff. I could not laugh. It hurt. It didn't hurt. It was more like really uncomfortable to yawn, to chew, because this section here, like right above my mouth, like now I can open my mouth and it doesn't feel pain. It was not pain, it's just discomfort. I think it was a lot of the reason was because my nose had gotten taller, it had stretched my skin, so it tightened everything. So moving around was quite uncomfortable. So chewing, I couldn't open my mouth very wide and I couldn't laugh. So that was a problem because I was hanging out with some of my friends who obviously are very funny and we were having fun. So I was just like, I couldn't laugh. Like I was telling them, I was like, don't make me laugh. And if you know me, like I'm like such a giggly person. So it was really painful to like not be able to laugh. Anyways, so then we move on to day 5 and 6. Okay, in my notes, it literally says day 5 and 6 suffered the most. I don't remember this exactly, that's why I had to write these notes. But I've got nostrils are severely swollen. I think at this point the swelling had gotten worse, or maybe it's not gotten worse, but my splints had really helped in the fact that it was keeping my nose open to breathe. And now that I didn't have splints or bandages in, if the swelling wanted to enlarge or close up my nostrils, it could, because there was nothing there keeping it open. So I couldn't breathe at all. That's when the dry mouth started to get worse. And throughout the night I had to drink water. I had some water beside my bed. I would wake up, I think at least like 6 times in the middle of the night just to have sips of water so that my throat did not dry out and stick together like I had experienced. I thought my sleep was bad in the first 5 days. It got worse after that. 5 and 6 was terrible. I guess that's why I wrote I suffered the most these days. Then we go to day 7. I go back to the hospital. So I hadn't been there for 2 days because that was 2 days ago was the last day I had my drip and my bandages removed. So then day 7, they came to check up and we're just seeing how the nose is going without the bandages on. Oh, I forgot to mention as well, every day I had gone into the hospital for my drips or my checkup, they would clean every single incision site and they'd check it, put a new bandage on, all that jazz. Up until that point, no one had cleaned the inside of my nose. I was too scared to like get cotton bud or whatever, shove things up my nose because I wasn't allowed to. Like basically there was like nothing had set in my nose, so if I touched it, something would have moved. I complained to my nurse. I was like, please help me clean my nose. I am suffering, I can't sleep. And I had gotten the same nurse every day at that point, so like we'd gotten to know each other basically. And he was like, yes, I'll help you. So he lays me, like I'm laying down, and then I had my head tilted up. I had a flashlight going into my nose and he cleaned the inside. The amount of dried snot that came out, and it was like scabbing and it was a bit of blood, like dried blood all in there. As soon as he finished cleaning it, oh my God, I could breathe. That was the first time I could breathe out of my nose since I had got, like before getting the surgery. Also on this day, my nose stitches and my ear stitches came out. So my nose stitches was not just here, it was also inside. I asked him before he took it out, I was like, is this gonna hurt? He was like, it will hurt the nose, but not the ear. And I was like, okay. So I'm laying down, he's taking it out. It wasn't like painful, it was more just like, I can feel the tugging and it just feels like there's a bit of sharp pain just from things moving around, and it was a bit of, there was a lot of pressure building up because once he pulls my nose one way, like my whole face felt like it was going with it, like because like I mentioned, my skin was very, very tight. Then day 8 came, and my nostrils were slightly more open, less swollen, and I was cleaning it myself before going to sleep with some cotton tips. That was fine. I was getting better sleep. Day 9, I was starting to get used to breathing through my mouth and slightly through my nose. Like, it was very shallow breaths if it was going through my nose because it was so swollen. Day 10, the rib stitches came out. I didn't get any pain. There was some tugging from here, and I have a photo of my rib scar right as it took out the stitches. So if you're squeamish, just skip. And I thought to myself, why is it white? That looks like an infection. And I asked him, I'm like, is this infected? He's like, no, this is just like dead skin cells that will dry up and whatever, which is true because it's completely fine now. And then day 11 to 13, at that point I was breathing through my nose more than my mouth. It was still very swollen, and I was breathing very, very loudly in my sleep. Then day 14 came around. I had my final checkup with my doctor and my nurse. They filmed me and used me for marketing. So here are some things that I had questions about for my nose to my surgeon after I had gotten it done. When can I wear makeup? So I was allowed to wear makeup after a week. I didn't though. I waited till 2 weeks, the 14th day when we were filming with them, that I put makeup on, because I was quite scared to like use a beauty blender like on my cheek because it felt very tight still and very uncomfortable. So at the 2-week mark I was completely fine and I was more comfortable. When can I wear glasses? You can wear glasses after 3 months, after the nose is kind of settled and everything kind of fuses together. When can I do a nasal rinse / irrigation? I was able to do it after 14 days. I've done it twice now. Let's just say I don't like it. It's not because it's painful when I'm doing it, it's the aftermath. It's the 20 minutes after me doing it where I have just complete snot dripping out of me like water, and it just doesn't stop. And the fact that I can't blow my nose. I'm not allowed to blow my nose because I think they're worried that if I squeeze my nose, because if you blow your nose, you like squeeze it and move it around and stuff, which is that's not allowed. You cannot move your nose like this. Yeah, so if I have like snot dripping out of my nose after a nasal irrigation, I can't blow it out. So it's just gonna keep dripping and it's gonna be annoying. How long will swollen nostrils last? Okay. So they were saying that some patients experience it up to 6 weeks. I'm on the 4th week. This is post-op 4 weeks and I still have the swollen and I don't see it going away for 2 weeks. I have spoken to other people that I know have gotten similar surgeries like septum surgery and sinus, all that. They said it didn't go away for months, and sometimes they occasionally wake up with it swollen and then by the end of the day it goes away. So I think this is more of like an individual kind of thing, like it's up to the person. What no one can really prepare you for. I think I mentioned quite a few of them already, but I've just got some listed, is if you sleep on your side and you're a side sleeper, you are gonna be in for a rude awakening because you can't sleep on your side. So when I had the cast in, it was okay for me to sleep on my side because the cast was holding up my nose, and I had my rib and my ear stitches on one side. So I was sleeping on this side as recommended by my nurse, so that I wasn't in pain and leaning on this side. Obviously when I touched it, it was painful, but I didn't have pain just like residing there, just from. So I was sleeping on my side, and then when I had the bandage off, I was like, now I can't sleep on my side because nothing's holding up my nose. And if I sleep on my side, there's a risk of it starting to lean onto one side of me if I sleep predominantly on one side. Sleep on your back for, let's just say 3 months. Yeah, so ask your doctor and your surgeon what they would recommend about sleeping. Mine was just, I'm not gonna sleep on my sides for a few weeks to 3 months, so just to be safe. Okay, another thing is the weird sensation on your nose, on your face after you get it done. So I was talking to my mum about this as well as soon as I got it done and after I gotten the bandages off, because when you have the bandages on, you can't really tell if the sensation you're feeling is from the pressure of the bandage or from actual, like the nose. So after I got the bandage off, I was like, this feels really weird. Like I can't really explain it. It just feels like there's something really heavy on your face. You don't exactly know what it is. It's like a rock is attached to your face and it just stays there all day. Like obviously it's gonna be there because it's attached to my face, but it felt really weird. Like even touching it, like touching the tip of my nose. Now I'm kind of used to it, so I don't feel that heaviness from it. After I had taken my bandages off, I touched my nose and it felt like my finger knew that I was touching something, but my nose didn't know that something was touching it. Like it was like there was such a disconnect from the sensation of touching and being touched on my nose that I just can't explain it. Like you literally just have to go through it to know how it is, but I tried to explain it the best I can. Also, okay, I went through an identity crisis. Okay, after I got my bandage taken off, I was looking into the mirror, probably a little bit too much because I was not used to how I looked. Like I thought I looked really different. People around me didn't said I didn't look that different. Maybe they're just trying to comfort me, but like not in a bad way, but it was just, I had an identity crisis because I was like, that is not me. Like, think about it. You've been seeing your face for however many years, for me, 23 years, and then all of a sudden it just changes. The nose is such a small surgery and it's such a small feature of your face, but it's right in the middle. So you gotta notice it. And I felt so weird. Like I said to my grandmother, I literally said like, I think I'm starting to hate the look of my nose. And she was like, stop looking in the mirror. Like you are freaking yourself out. So then that literally the whole day, I did not look in the mirror once. Like now I'm used to it. I'm perfectly happy with it. So to conclude, let's wrap up this video. It's getting a little bit too long. I'm so sorry. If you're staying to the end, you are a real fan. Thank you very much. How was the overall experience? I would say it was really positive. I had no pain and the service was amazing, okay? The nurses are so nice and they're so helpful. They're just always willing to help you and answer your questions. They like, because you're there so often, they get to know you and they know you're there. So every time I walk in, they're like, Jessica, you can go straight up to your room. Like, they're just like, no, straight away. So they're very sweet and they're very helpful, which is what you want, especially if they're taking care of you. So if I have any tips for anyone that is doing a nose job, nose surgery, just be prepared that you may have an identity crisis like I did. Don't look in the mirror too much. Don't be so shocked. Like, just relax, like, you know? And also, don't be scared of the pain. Like, maybe it's just me and I have a high pain tolerance. Jerry was saying I have a high pain tolerance, but don't be scared. I'm lucky and I had a good surgery. But at that hospital, specifically at JW, they were doing noses like day in and day out. There were patients there like every single day, a few of them a day, doing surgeries, and they are very well experienced doctors and surgeons. They checked on me every single time I'm there, not just my nurses but also my doctors. They would touch, they would look to see if anything was changing in the wrong way. They would ask me if I wanted anything different. I'm happy. So scarring. I received a serum from them for scarring. It's made from stem cells, so it obviously helps regenerate your skin tissue and it's a lot better for scarring. And I just dab it on. You're supposed to put it on 3 times a day, but I am so lazy, so I just put it on morning and night. So if you want a better look at my nose, I do have makeup on, so yeah, it is still swollen quite a bit just here, especially because of my inner nostrils. That's why it's so swollen, like here. Sticks out a bit. How much did it cost? So I'm sure this is the thing that everyone asked me. It costed just over 5,000 AUD, which included literally everything. It included my one night at the hospital, my medication, my drips, my checkups, the serum, everything. Another benefit is that there is a 5-year, this is weird, 5-year warranty for my nose. So if you don't like it or you do want to change something, you can go back within 5 years and they'll fix your nose for you. I got a free dental voucher, so I did get my teeth cleaned and checked before I left in the same hospital. Thank you so much for watching. If you stayed to the end, you're a real one, because I just yapped this whole entire video. This is not my normal setup, but I just wanted to have this little sit down, because stay tuned for the rest of the Vietnam videos. I have quite a few lined up. They're already edited. I just have to upload them, but I wanted this to go out first. Thanks for watching. Bye.